Welcome back to Coffee Talk with Mike and Janelle. We are in episode 6 and we're going to continue our conversation on common side effects of medications. So today I wanted to bring up anticholinergic syndrome. This is very common. We see this with a lot of the folks that we work with, and I just want Dr. Cummings to explain that a little bit more to us so we have a better understanding of what to look for.
Of course. So anticholinergic side effects or syndrome are very common. There are many medications that we take that have these types of side effects. They bond to cholinergic receptors in our body and block them. And the result of that can be things that affect the entire body. Most common, dry mouth, constipation, decrease in cognition, difficulty thinking and processing things, unsteady gait, in the worst case, delirium, where you can become very confused and actually need hospitalization. So they're very common. Many psychiatric meds and many general medications cause this. So from a psychiatric medication standpoint, many antipsychotics, most notable Zyprexa, clozapine, Seroquel, among others. Antidepressants, Paxil, nortriptyline, amitriptyline, and something that people don't think about a lot, but are used a lot both as prescriptions and over the counter. Benadryl, Vistaril, also known as hydroxyzine, very commonly cause this. So it's really important to have discussions about anticholinergic properties of medications because these side effects can lead to all kinds of other medical problems, discomfort, and things that really affect the population that we treat, the IDDD, ASD population.
Well, even with the cetrizine I take for my allergies, I mean, I'm extremely uncomfortable, but I put eye drops in or I'll drink water. But I'm able to easily express that, and a lot of our folks cannot. So a lot of these medications you have to be on. It's not an option. So what do we do? How do we lessen this burden?
Well, I think the general theme that people see as we go through these various videos is, first of all, making sure you have the right diagnosis so that when we say you have to be on this medication, or you should be on medication like this, making sure that's actually true. Always think about polypharmacology. So we're trying to decrease medication burden, the total number of medications, the frequency that they're prescribed. And then in this case, trying to lower the anticholinergic burden of a patient. And that really involves looking at all meds. And that's one of our primary goals at APEC, trying to do that. So there's different ways you can do this, right? So sometimes maybe someone benefits by being on an antipsychotic medication, but we can swap one from like a Zyprexa maybe that is causing one of the other things I didn't mention is urinary retention that is causing
Yes.
urinary retention or constipation, and maybe we can move it to something like Haldol that has less anticholinergic side effects. Now, of course, Haldol will have different side effects, but that's why it's always a balance and a risk benefit. Sometimes we're giving medications for other side effects of things. So many people on antipsychotics are at risk of movement disorders or at risk of dystonia, which is a contraction of your muscles that can be very uncomfortable, and they'll be given something like cogentin for that. Well, rather than have a medication and a medication for its side effect, maybe we can switch that medication to something that's less likely to cause dystonia and therefore be able to get rid of the cogentin that's also causing dry mouth, constipation, urinary retention, other things like that. So it can be very complex, far more complex than what we can discuss in a short video. I guess the important thing is to be aware that anticholinergic side effects exist both in psychiatric meds and in many other medications that you're taking both over the counter and by prescription, and having that conversation with your prescriber, your primary care doctor, your psychiatric provider.
And again, they're not always psychiatric meds. And I have a lot of concern for this particular side effect just because in our population, especially nonverbal folks who cannot express this,
Right.
they already have a lot of predisposition for GI upset and that sort of thing. So constipation is just compounding this whole thing here, and that's going to likely, if they're unable to express this, come out with aggression, SIB, that sort of thing. So,
Absolutely. I mean, the autism population has, in many studies, up to 70% of individuals will have separate GI complaints,
Yes.
As opposed to about 18% of the non-autistic population. And study after study, GI complaints are associated with agitation, self-injurious behaviors, and aggression. And so, these are really important things to be thinking about with all patients, but certainly with the IDDD and especially the autism spectrum disorder patient.
Very good. Well, thanks again for all of your knowledge. We appreciate you. And until next time,
APEC
APEC
out.
out.